Well, tonight we're trying to do our best to analyse the federal budget 2022. The health budget consists of probably more than $100 billion of expenditure, and being able to capture and fully analyse that in the space of a few hours is an enormous challenge. We've done our best. So we'll be sending out this document to members of PHAA tonight, but the most important frame that we're going to be putting through this budget is the National Preventive Health Strategy. This is a document that we participated, contributed to, and was launched in December of last year. So we thought we'd test this budget against the National Preventive Health Strategy and the things that it offered. Firstly, it's important to understand that this budget is very, very, very much about treatment and pharmaceuticals. Continued enormous public investment in health through those two lenses. And more big boosts in those areas are evident tonight. But when we put that lens of public and preventive health, and that preventive health strategy, I'm sorry, but it's an F-. The blunt truth is that this is not going to take us one iota towards that 5% for public health. It's simply not. In fact, the likelihood is that it's going to come back. Now we can get into the fine detail and argue the toss on that. But here's the blunt truth. This government has not done well on public or preventive health. Every year we've been promised, yes, next year. Yes, next year. It'll come next year. It still hasn't come. This government has failed on public and preventive health, and this budget is the final nail in that coffin. Whoever the next government of Australia is, they must do better. They must take a long-term view, whether it's across workforce, where we saw important investments. The message about the importance of health workforce is starting to get through. We've seen it in mental health and primary care in a range of areas. Not a ZAC for the long-term investment of the people who are essential for the expertise and leadership to tackle the next challenges when it comes to communicable disease, chronic disease prevention, the full gamut of the important public health issues we're tackling in this country into the future. This is an excoriatingly disappointing budget for us. And it's important that this government knows it. It's important that whoever's coming next knows it. They've got to do better. We've got to take a long-term view of health in this country. This budget doesn't do it. I'm sorry, that's the truth.